And as I see, at this moment, we do not have question from the audience, but I would like to ask the panelists whether they have a question or not. And as long as you're thinking about your question, I have some question to the presenters. First of all, I'd like to ask Professor Müller. She showed us about treatment possibilities. But as I know, we have also other antiviral therapy like remdesivir. Do you have any experience with this? And what do you think, where is the place of remdesivir?
Yes, we did not use it during the first wave, but we used it already during the second wave. So all actually now in pipeline therapies are available, and we use them. We have big hope in these new therapies that it will work for a lot of patients. So we are waiting for the results, but first experience are good.
Thank you very much. I see that Professor Soriano has a question. That before you ask your question, let us ask you. It was an excellent lecture. I really enjoyed. But I would like to ask you about cultural differences. What is your experience? How cultural differences may actually influence the pandemic? I mean, social distancing in different countries, or wearing the mask and so on.
Well, thank you, Professor SZABÓ, for your question. On cultural differences, well, we are all different, and we are from different countries, from different backgrounds. I'm sure that the way that we approach a problem within our family, within our neighbors, within our university, within our community is something that explains part of the problems that we are experiencing with controlling the pandemic. I'm sure that the level of complying with recommendations from public health officials, I'm sure that you agree with me that some people, but in every country, then they say this is not important. We have the negationists with the vaccines, we have the conspiracies, we have the political fights that whatever you recommend, I will go against that. And again, this does not help. So if we learn the lessons from history in the plague, in multi-drug resistant tuberculosis, in every single pandemic, including cholera, the individual actions matter. And what we need to do is education. We have to be persistent and also very clear in giving recommendations to our students, to our colleagues, and to our families that individual actions matter in reducing the burden of this pandemic. And now, if I have the microphone, I could have a quick question to Professor Bella Markelli. I love I don't know if he's still in the Zoom, or I don't know if anyone from his team could comment, but I love his position on the Age Uncovered survey in Hungary. I look forward to read it in a high impact journal, especially because not only the response rate, 77.7 response rate, but also the quality of the data. And perhaps we need to talk, because in our university, we are granted a Horizon 2020 funding for this type of cohort and pulling together our data and our patients. But I wanted to specifically ask Professor Markelli about the hypothesis that we're testing in our hospital, especially we're seeing that women overweight and with Latin American origin are experiencing more severe COVID-19, and they eventually go more often to the intensive care unit. So I don't know in Hungary if there are a lot of Latin American people, but I would like to check if they can explore this hypothesis of women with overweight and severity of COVID-19 in their cohort? Thank you.
Actually, Professor Merkel is not here, as I see, but maybe Professor Müller or I can answer your question. So what we see here in Hungary and at Semmelweis University, that we have much more and more severe overweight patient. And also in the ICU unit, a lot of patients with overweight. Even we had a patient who died without any other known comorbidities except the overweight. In a young age, we had also patient under 40 with morbid obesity, but not other known problems. That it seems to be really a problem, the overweight. About Latin Americans, I cannot tell anything because we do not have in Hungary, but what we don't see, or we do not have at this moment as many patients as we can make a statistic. What about the Caucasian and the so-called Roma population? So we do not see at that moment any differences, but the numbers are quite low. I don't know, Professor Müller has any other comment to this?
Yeah, I just want to reassure that morbid obesity seems really a big issue. This is with a non-communicable disease and the communicable disease, this is somehow an interaction. We have to study this further. Very good point.
And the other thing that, of course, we are open to cooperate with you with this age uncover or uncover study. So we as Professor Merkel showed, we would like to continue this study here in Hungary. So, and Professor Street has also a question.
Would you like me to ask it directly? Yeah, I was interested in Professor Merkel's suggestion that the second wave is less intense in places that have experienced a bad first wave. And he suggested that this was down to behavior in some way, that because people were sort of scared from having had this first-hand experience in the first wave, that they were more likely maybe to comply in the second wave. Or I wasn't clear whether maybe he was possibly suggesting that governments had had a bad experience in the first wave and so were more likely to introduce measures earlier in the second wave. It wasn't clear which one of those it was, but nonetheless, this doesn't seem to be borne out either way in the UK. And so I was just wondering whether the epidemiologists on the panel had any thoughts on this pattern and how the first wave impacts on the strength of the second wave.
Professor Soriano, do you have any comment or?
Yes, Professor Street makes a very important point. Always predicting the future is difficult, especially in things that people can modify habits. For instance, the meteorologists have a prognosis on weather. They are always wrong, but whatever they say, it does not affect the future. Even geologists, sometimes they prognose earthquakes in 100 years or longer, and whatever we do does not affect that possibility. But in polling, elections, or in medical things during a pandemic, there is a conditional probability. If you prognose something, especially that is bad, the people change their behavior. So I buy the hypothesis that in some countries that experience a very severe first wave, that people have seen the devil and actually they follow recommendations more strongly. For instance, in Italy, the beginning of the first wave was before some other European countries. Actually, the first incident case in Europe was in Italy. And actually, the second wave is less severe in the population terms than in other countries. So this is something worth exploring.
I wonder, would it be possible for me to come back in on the culture question? I thought that the question about how culture impacts on maybe different kinds of responses internationally, and I think this is a really important question. But I think what's interesting about COVID-19 is precisely that many of the measures used to address it actually depend on people acting on behalf of others. So we wear a mask to protect others, not to protect ourselves so much. And we quarantine to protect others, not necessarily to protect ourselves. And these measures vary from being kind of intensely difficult to actually mildly uncomfortable. But nonetheless, it depends on a kind of social solidarity, both within our communities, but also in our international community, because there's a kind of drastic shortage of the resources, whether that's vaccines, tests, or supplies, or PPE, also to address this disease. And there's obviously a kind of competitive marketplace, and there are winners and losers. And so we need a kind of international solidarity to ensure that these resources are distributed equally and get to where they're needed. And so I think there's a kind of cultural question about how solidarity is fostered as a value in a society. And I don't think this means that there are just some cultures which have solidarity as a value and some don't. So I think we need to understand it historically. But certainly in the UK, there's been an attack on solidarity as a value over the last few decades. And actually, we saw in our results from our research here in Scotland that there's intense anxiety about whether social solidarity still exists. And there's this sense that this pandemic is actually a test not only of government competence and government care, but also a test of society and whether it exists or not. And there's a lot of concern about this. So I think that in thinking about how to address this pandemic, we need to think as much maybe about how we can help foster solidarity and social solidarity as how much we can maybe develop new medical technologies.
Alice, I cannot agree with you more. I mean, culture plays a significant role in this and the next pandemics, and this virus, like any virus, does not know borders. So perhaps culturally, at every country, we are slightly different, but what happens this week in our country can happen next week or next month in the neighboring country. And we are seeing this with the second wave. And as an epidemiologist, for instance, in the first wave, India, Pakistan, or Indonesia, they were not receiving the virus, but now they are, and social distancing in these countries is virtually impossible. So we have to be ready to have solidarity, especially because we are at risk of getting another influx of migrants from these Asian countries to Europe. And the solidarity not only is a moral responsibility, but it's a preventive issue. Otherwise, we'll have another international crisis.
Thank you very much. And thanks all the presenters, excellent lectures. And I would like then to close the morning session, and I give back the words to Vicky. So thank you very much again.
Thank you very much for the excellent comments and presentations. And we kindly invite you to join us in 5 minutes again. We will have a few